Good morning, 8:30. Okay, I know I didn't even announce what time I'm going to do the live, so I don't know if anybody can join, but that's okay. I have 4 more days left. This is 36 days. And I was looking at the YouTube comment, and then there was one comment, actually, request that they wanted to know. It's not only our students watching, so somebody was asking how to identify the correct cutting edge. So I'm going to try to show how to easily identify correct cutting edge. Okay, today. Okay, let's see. First, I'm going to show this diagram. Okay, I just quickly wrote this. Principle of instruments. If you know these three shapes or three relationship, I think you would understand what type of instruments we use in dental hygiene. We use universal curette, sickle scaler, and Gracie curette. Both universal and sickle, the relationship from this terminal shank to the face of the blade is usually 90-degree angle. Recent innovations, some innovative things could come offset. Like offset is something like this. The relationship to the terminal shank to the face of the blade is not 90-degree angle. So when it's offset, that's the time you probably having a hard time finding which cutting edge to use. Okay, so whenever these terminal shank is 90-degree angle to the face of the blade, you have to create your own angulation. So this terminal shank will become a visual cue, and you will put this terminal shank a little bit more towards tooth side. So you will use one cutting edge towards the tooth, creating that 40 to 70-degree angle. Okay, so these are the easy. I'm gonna demonstrate later. But here the Gracie curette or some other innovative instrument came out. Terminal shank is not necessarily 90-degree angle to the face of the blade. Then usually the lower cutting edge, okay, lower cutting edge here, when you see the terminal shank face and then the more slanted side, okay, is the cutting edge you use. And usually non-cutting edge is not sharpened for Gracies, but some innovative newest instruments, both cutting edge may be sharpened, but I don't know how you can use the other end much, but at this end, the lower cutting edge is the one to use. So that's the principle of the how to identify cutting edge, but let me do the clinically. Okay, so let me see here. Hopefully I can show you better. Okay, so I do have actually 13, 14 Gracie here, and then this is 204 SD. When you're looking at these two instruments together, the design is very similar. The shank bend is very similar, but how it's that one is sickle, the pink one is 204 SD, it's a sickle, and then the other one, Grace, is a curette, so rounded toe. So when this happens, and then Gracie's, if you look at it very carefully, I don't know, I can see you showed you this well, maybe in a white background. Okay, all right, I don't know if you can see, but I want you to put this terminal shank perpendicular to the floor, and then you will see one of the cutting edges more slanted. Okay, then that's the end to use, okay, for cutting edge. So for this purpose, okay, I don't know if you can see. Okay, if you're looking at it from your screen, slanted side is actually on your left side. Left side of the screen should be slanted side. So that's the cutting edge. Okay, so always make sure the terminal shank is perpendicular to the floor or when you're looking at it. Okay, all right. Okay, so then this is a 13, 14. Then using this cutting edge here, I'm gonna use extra oral fulcrum. Other thing is, Gracie is very easy to identify. If terminal shank is not parallel, you cannot really use it. So here it's extra oral fulcrum right now. Okay, if a terminal shank is parallel to the surface, then you feel this cutting edge is gonna engage into this tooth surface. Okay, so if a terminal shank is parallel to the surface you're working on, it's automatically creating that 70-degree angle because it's already slanted. Let's say you did not know which end to use and you flipped the other end and used the wrong end. Okay, this terminal shank is not parallel. Okay, then it is not going to be useful. But you can make it parallel by going like this, but it's impossible because there is a slot and then there is a neck of the patient, so the handle would never be placed like this. So here is one way to identify this is wrong end. Okay, this is the correct end. Especially with 1314, it's easier to determine. There's another visual cue, which is this V, the bend, is always towards this distal. This terminal shank to the first bend, this corner, okay, all right, this corner has to be pointed towards the distal surface. That would be the correct end to use. So that's another way to identify. My 1314 is very sharp today because I was sharpening it yesterday. So now it's like sticks to the tooth right now. So I feel okay. So extra oral, if you are practicing every day, I want you to practice extra oral of this distal of maxillary. Again, this is a weak spot. You are not, your thumb is giving the lateral pressure, your middle finger. If necessary, you can use this reinforcement from the back, from the distal surface to the tooth surface. Okay. All right, this is a little wobbly here. Okay, so this is today is a 1314. Okay. All right. So then, about then sickle. Sickle would be very similar way. If you look at it, this bend, first bend, could be pointing this distal side. Okay, that's okay. But because this sickle is 90-degree angle to the terminal shank, you have to close this terminal shank slightly right here to create your own 70-degree angle. Okay, so okay, this one is not as sharp, so I better sharpen it. Okay, so sharpening, we should do this. Okay, as soon as you notice a dullness. So this time I cannot do it, but okay. All right, so or you can come up here into oral and then close this terminal shank a little bit more towards the tooth side. Okay, very small strokes. Okay, go. All right, so something like that. So sickle, you're gonna close terminal shank. Gracies, you keep the terminal shank parallel. That would be the visual cue, and also this bend is going towards distal. Okay. All right. So then same principle. Some people ask about then universal. Universal is right here. Okay. So terminal shank is not going to be parallel, and then that's usually the cutting edge you're gonna use here. Okay, so slightly more to side, and also it has a little like curvature, so it hugs the tooth. If it's hugging the tooth, that's a good side to use. Okay, but if I rotate here this way, distal, this is hugging the tooth, but another key principle is this bend. The V is not pointing to the distal, so this is technically not the correct end. For the posterior, This is a tricky part, but here you're gonna use the V or this point towards the distal, okay, and then close this terminal shank a little bit more. Okay, I don't know if you can see that. Okay. All right, so it is 8:40 already, Tuesday. Okay, 15th week in our semester. 3 more days to go. I'm gonna have my top 3 favorite techniques next 3 days. So I want you to, yeah, watch last 3 days if you can. Okay, but thank you for watching, and then bye. Take care and have a good day.